To evaluate the pelvis for the FAST exam, place the probe in long axis at a 45-degree angle pointed toward the patient's feet, just superior to the mons pubis. The indicator should be facing the patient's head. Then fan laterally from each lateral wall to evaluate for any fluid accumulations between the patient's bladder and their reproductive organs. Then turn the probe to short axis, again still at a 45-degree angle, but with the indicator toward the patient's right side. Then fan inferiorly and superiorly to evaluate for any anterior or posterior fluid collections in the pelvic area. Because the students are learning on normal models, it's important to go over with them where the fluid should be if the FAST exam were to be positive. So here we see a normal long axis female pelvis, and we can see the endometrial stripe, the pear-shaped uterus, and the cervix at the bottom, as well as the bladder. All the dotted lines in this image demonstrate where fluid could be seen if the FAST exam was positive. The red dotted line indicates all possible places. The yellow dotted line, most posterior in the image, is the rectouterine space or the pouch of Douglas. This is the most dependent part of the pelvis in the female, and where we will see fluid more often. The first place where we'll see it, it can be very, very small but significant. If it's a large bleed, it would be very obvious. If it's a large bleed, we also see the separation between the bladder and the anterior part of the uterus as well, and that's the vesicouterine space. So these are the spaces that we want to make sure that the students can identify when looking at a long axis view of the female pelvis. Moving on to short axis of the female pelvis, we can see the uterus with the endometrial stripe, which is very hyperechoic in the middle. It looks a little bit like a flattened donut. And then we see the bladder anterior to that. So the short axis view of the female pelvis gives us a really great overall view. We can see fluid collections not only anterior and posterior, but at the same time laterally. So the red outlines in this image indicate that. So make sure that the students understand this and can point out these areas to you. Moving on to the male pelvis. In this image, we see both a long and short axis view. The short axis view is on the left, and the long axis is on the right. The large anechoic structure in the anterior part of the image is obviously the bladder, and then the prostate is immediately posterior to that. You can see it very clearly in the long axis view. That's the hypoechoic structure that's walnut shaped. And you can see a tiny little tail at the end of that in the long axis view, and that's part of the seminal vesicles. So the seminal vesicles are an important structure to be aware of when teaching students to scan the bladder for the FAST exam. They can be a real mimic of fluid, so it's important to be able to recognize what normal seminal vesicles look like. They're very, very hypoechoic, almost anechoic, and it can be a pitfall that the students might think that there's fluid here when it's actually a normal anatomical structure. So you can see in this video that the seminal vesicles are just posterior to the bladder, and then the hyperechoic arced line posterior to the seminal vesicles is actually the rectum. So it does look like fluid, and it's really important to point this out to the students and be sure that they can actually point out to you normal seminal vesicles. This image demonstrates both the long axis and short axis view of the pelvic exam for the FAST exam in a male. So on the left is the short axis view, and you can see the prostate, which is posterior in the image, and that demonstrates where the fluid could be both laterally and anteriorly and posteriorly. The image to the right is the long axis view, where you can clearly see the prostate, which is the walnut-shaped structure, and this will demonstrate any fluid collections that are in the lateral distribution in the patient. So the pelvic exam for the male FAST exam is full of pitfalls and mimics. In this image, you can see this is a positive exam, but where the fluid is will definitely be confusing for the students. So let's go over this a little bit so that you can help them to understand what they would possibly see. Unfortunately, there are a lot of structures here that are very hypoechoic, almost anechoic. So the patient has a layer of fat on the top, which looks almost anechoic. And then there's this second area more posterior to that, which is free fluid. And then below that is the fluid-filled, the urine-filled bladder. And so it's really important to figure out what's fluid, what's normal fluid, and what's not fluid. So how do we tell? We make sure that we look at the prostate, and immediately anterior to the prostate should be the bladder. And you can tell if it's the bladder or not because the wall of the bladder will be slightly thickened and well defined. So the free fluid, therefore, will be less defined. It will be contained only by the soft tissue structures, and it will be very, very anechoic and irregularly shaped. And then fat has a anechoic appearance, but it actually does have some echoes within it. So, and we do expect fat to be on the anterior part of the image. Most people do have anterior fat on their abdomen and pelvic area. This clip demonstrates another teaching point for the students when scanning the male pelvis for the FAST exam, especially in short axis. You can see that if they just stay in one spot, that they would miss the extent of the free fluid and the amount of abdominal bleeding that there is. So it's really crucial in short axis that they make sure that they scan all the way inferiorly and all the way superiorly to catch the full extent of the abdominal bleeding. Moving on to the male pelvis FAST exam in long axis. Again, this will have more of an evaluation of the lateral extent of a abdominal or pelvic bleed. In this image, you can see the prostate outlined in yellow, the bladder outlined in white, and then the free fluid, which is more cranial to these structures or toward the patient's head. Again, it's very important to remind the students that once they have acquired a long axis view of the male pelvis for the FAST exam, it's imperative that they fan laterally to both lateral walls to evaluate the extent of the pelvic bleed. If they don't, they could really underestimate it. Moving on to the female pelvic exam for the FAST exam, you can see this is a long axis view. You can see the uterus outlined in white and the free fluid, which is more toward the patient's head or superior, outlined in red. You can see clearly that there's a lot of fluid here in the rectouterine space or the pouch of Douglas, and it has not extended anteriorly toward the top of the fundus of the uterus, though. Moving on to short axis of the female pelvis, we can see here clearly annotated through the red dotted lines where the free fluid would be. Again, like every short axis image of the pelvic FAST exam, you get both anterior, posterior, and lateral locations for the free fluid. So there aren't as many pitfalls for the female pelvis, especially in short axis, as there are for the male pelvis. But it is really, really important that we remind the students that in short axis they still have to fan both inferiorly and superiorly to catch the extent of any fluid collections and the extent of the pelvic or abdominal bleed.